Okay, so tennis elbow is a common condition that particularly physiotherapists see. And tennis elbow affects the extensor, carpi, radialis, brevis tendon about 1 centimetre or 2 from the elbow joint down, and it can get inflamed. It comes from backhand in tennis, it can come from golf, and it is quite painful. One of the tests that we do for it, if you put your hand flat on the table and extend the middle finger, is if that reproduces the sort of pain, it is linked to being a positive for tennis elbow. And you've got another test where if you clench your fist and extend the elbow, extend the wrist back and try and resist me from pushing that way, you may feel the same sort of problem in the tennis elbow area, or the extensor ECRB. So treatments. One of the best treatments for tennis elbow is therapeutic ultrasound, and that basically, the hypothesis behind it is that it will use sound waves to penetrate into the tissue, and it's particularly good at areas that haven't got much blood supply. So tendons, ligaments haven't got many blood vessels coursing through them, and it makes sense that if they haven't, then they might take longer to heal, and the ultrasound could then help heal it. So it's pain-free, pain relief. Use a coupling agent, which is a transmission gel. You put that over the area, and it's quite similar to when a woman's pregnant and you see a baby on a screen, in that the sound waves you won't feel. So a woman who's pregnant, you put it on the belly, don't feel it apart from you rubbing on it. Same when you use it as for therapy, but it's not for diagnosis. And the patient, all they will feel is you rubbing over the skin. They won't actually feel the sound waves going in and helping. One of the other things you can use, especially for tennis elbow, is cross-friction massage. So the tendon actually goes longitudinally, or basically you want to go across it. So that's why it's called cross-friction. So just like transverse, and it's quite tender. So you can do that at home if you have it. And the other thing is cold spray, cold gels, and on top of that, the other products that we have are elbow braces. So Oppo is one brand, but there are plenty of them. And what this has in it is a little gelatinous, protective, absorbing material. You put that over the area, put it on, and the compression also helps with the recovery. As the first principles in first aid, you've got the RISO, rest, ice, compression, elevation, and this can also help for that. You obviously want to get the right size, but I think this is one size fits all. And you can wear it quite happily while you're working, and it's kind of inconspicuous within reason. So that's another thing that you can use to help if you have tennis elbow. So supports and back braces and things like that you shouldn't rely on, but initially in the first acute stages they're not a bad thing to have around. And always seek physio or chiropractic or osteopathy care out for any muscle or joint problems.